a parent, hearing your child cough may make you feel uneasy. Cough protects your child's body by removing mucor, irritating substances, and infections from his or her respiratory tract. However, coughing that lasts more than 2 to 3 weeks should prompt a visit to your physician. My guess is you do not even wait that long before you see your physician. Well, joining us for more on this is Dr. Oluwole Ayodele. He's a consultant pediatrician. He joins us virtually. Hello, doctor. Thank you for joining us today.
Thank you.
All right. Well, our focus today is cough in children. And my first question would be, how concerned should parents be when their children cough?
Yes, I think every mother, every father should not feel at ease if your child starts coughing, especially if that cough has persisted for 2 to 3 weeks. That is worrying and worrisome. And I think a solution should be found, should be thought for.
Okay. Now, let's talk about this. Now, since you've mentioned it, let's talk about cough that exceeds, 2 to 4 weeks and all of that. What are the likely causes?
Yes, there are many causes of chronic cough, many of them. Anyway, let us start by saying chronic cough is cough that has lasted longer than 2 to 3 weeks. What are the causes for chronic cough? Yes, the causes are actually varied. It can be from the respiratory system. It can also be from the adjoining system. But the respiratory system actually also, I think it tends to account for majority of cases of cough that are chronic in children. Among the common ones are things like asthma. Asthma is a very common time that parents want to hear about and are also scared about. Apart from asthma, allergy too can also cause a child to be coughing recurrently. And also a child who has also swallowed a foreign body is also a cause for worry. When I say a foreign body, I mean something that is not, he has aspirated a foreign body. I remember then in Lutz, there was somebody we saw, after about 6 months, the cough still persisted. Everybody was wondering, where is this cough from? So until we did some investigation that showed that this child has swallowed a bean seed and he has aspirated it. Initially, the bean seed was a small size. They haven't swallowed it down. It got a bit swollen. It's like it's kind of taking some water and so the size became bigger. And then that cough now came out even more because where the air passes, where the air is supposed to pass, for the fact that has actually occurred, it was difficult for child to breathe and the distress became very serious. Then apart from that, children also have allergy. Allergy is a situation where children react to things around them along their respiratory tract. Maybe from smoke, maybe from dust, maybe from pets in the house. So as long as they are constantly in touch with that trigger, they continue to cough. That can also be a source of worry to parents. Then apart from that, we also have children who have had a bit of catarrh maybe 1 or 2 weeks earlier on, and then as a result of that respiratory tract infection, it has left some imprint on the respiratory system that is continuing to cause the cough. Then apart from that, there are children too, each time they lie down, what we call the gastroesophageal valve, that is a valve that is supposed to prevent food from going back when we are lying down. But for some children, their own may not be perfectly tight enough. So some of those food can actually track down when they are lying down. And then the resultant effect is cough. Apart from all this, we still have people who have what we call a visual cough. There are also people, as I mentioned allergy before, there are children that their throat also itches them, and that in a way also make them to cough. So these are some of the very few ones. Apart from tuberculosis is also a very common one. We also must not forget the infection of the lower respiratory tract infection. That is the common pneumonia we talk about. That can also make children to cough. So we have a whole array of many causes for chronic cough.
Let us take them one, after the other. What are the accompanying symptoms that distinguish one from another? I am interested in allergies. I'm interested in asthma, and I'm also interested in what you said about some children that swallow things, and at the end of the day they start coughing. Let's talk about these three now. When it is the case that the child has swallowed something, what are the symptoms? When it is asthma, what are the symptoms? And when it's an allergy, what are the symptoms?
For the asthmatic cough, asthma is actually a chronic respiratory problem, and it follows a recurrent cause. So you see a child with a family history of whether the father or the mom or the grandparent who had history of asthma and who has also come up with recurrent episode of cough. Recurrent, that is the word each time we mention asthma. Their symptoms are also, there are things that also tell us to look out for asthma for such children. Some of them may as early as maybe in the first year of life, they start having common skin rashes that are a bit stubborn. It really never goes. Once you have that kind of pattern, and then child keep having recurrent cough and catarrh. And then in addition, child symptoms are worsening at night through early morning. And then there is difficulty in breathing, and then there is wheezing. That's more like a musical sound that such children have when they're having this problem. Like I said, recurrence is a factor that gives it away. It is not a curable problem. So it recurs, and then when we also nebulize such children with a particular drug, it relieves them of their symptoms almost completely or completely. And in another 2 hours, the child is jumping up and down. You start wondering, the same child that was that was very breathless before, sudden onset of cough and difficulty in breathing. So that is a pathway for asthma. Family history of asthma, even though not in all cases you see family history of asthma, it may just be issue of a one parent reacting too much to either some smoke, dust, and all that. For allergy, asthma actually is a form of allergy. Is a form of allergy. To be honest, it is just that it is the most severe form of the allergy. So whoever has issues with recurrent catarrh on and off, if he comes in contact with dust, he starts sneezing repeatedly, and night cough, recurrent catarrh too, then you know that they are actually in the same family, except that the asthma is the most severe form of the allergy. The lesser one, what they just have is more of recurrent catarrh, sneezing, each time they come in contact with such trigger, they start having this mild cough and catarrh. But their own may not be as severe as making them to have asthmatic presentation. Then the other one that has to do with aspiration is where a child has inadvertently, probably while playing with, we've seen so many children, no family history of asthma, no, suddenly a child who has been playful and running around, you suddenly find that he's having difficulty in breathing. And then for some of them, wheezing that is so common with asthma, you start hearing wheezing in them. But the wheezing in them actually is localized to a particular part of the chest, unlike asthma where the wheezing is everywhere. But this wheezing is caused because a particular branch of supplying a particular zone of the lungs has been blocked. So it is around that segment that you hear that kind of abnormal wheezing. Then you start wondering, how can somebody be wheezing on a particular part of the chest, and in the other area you are hearing clear sound? Then you start suspecting, could this child have aspirated? We have also seen children who also aspirate while feeding the normal food. Yes, usually what the issue you get there is this child has been having maybe some mild cough, and while eating, suddenly he starts choking. In the process of choking, he's coughing repeatedly, and then the next thing, 2, 3 days later, is in the hospital, difficulty in breathing. That is the pattern we see when the child has aspirated.